Okay.
Okay, good morning. Today, we are at our staff meeting at the Sedgwick County Commission office. Tom, why don't you?
Good morning, Chairman and Commission. We have 4 items today to cover in staff. The first, the sheriff will get up, and his world's been very busy, as we all know, for the last week or two. He will give an update on events or actions in the community that the sheriff's office has been involved in, and maybe talk about some strategies going forward. Ellen will get up second and talk about some court logistics that's going to be new next week regarding, I think, management of traffic court. She'll fill us in on that. And then we'll go into the 2 agenda items, which are the COVID update, which will feature Adrian and Tim, Rusty, and then we can talk about also the Dr. Min's opinion from Friday during that discussion. And then we'll conclude the meeting with a discussion and new data update on ICT1, and Dr. Gallagher and his staff are here today to talk about that. So with Sheriff, we'll let you get started, sir.
Morning, Sheriff.
Morning. Thank you for letting me come up here today and give you kind of an update. So I think all of you know, starting about a week ago on a Saturday, we started having some peaceful protests. And then Sunday it ramped up and got a little bit more hectic. And then Monday and Tuesday it was very volatile. And so just to kind of give you an update from where we were at last week, as you know, I described there was basically 3 different groups that was out protesting. You had the folks that were peaceful protesting. You had individuals that were lawlessness, kind of the anarchy group that was out there, and then you had the Second Amendment folks that were out there. And where we'd had a few of the protests that started off peaceful, the anarchy group would come in, take over, and then that's when you would have assaults against law enforcement, bottles being thrown, and on at least one occasion, officers being shot at. And so that transpired over into 21st and Mays. Same thing, very peaceful protests. They were out there for about 3 hours. This other group shows up. We had fights amongst the peaceful protesters and the anarchy group, and then we had one individual from the Second Amendment group, who all those folks were armed, got into it with some of the anarchy group as well, which caused kind of that mess there. We were able to clear that out fairly quickly. The sheriff's office did, without any other incidents. And so since that point, there's been nothing but peaceful protests. There was one Saturday that came to the city building and then down to the jail. And then there was one at Nasker Park, which was over by Intrust Bank Arena, and we had no issues with either one of those. And so it appears that hopefully we've made it past the part of some of the violent protests that were taking place. And now it's at a point where hopefully we can start speaking with certain segments of the community to start listening to what their concerns are and start looking at different ways to resolve some of these issues. I've already been speaking with our legislative liaison for the Kansas Sheriff's Association, some of the things that we can take a look at from a training perspective, although I don't think most people realize, and especially up in the legislative session, Kansas is kind of above the curve when it comes to training. We already are required and have been doing it for years to teach de-escalation training. I want to be very clear that the chokeholds and whatever they call the other hold up in Minneapolis, where they're kneeling down on someone's neck, aren't allowed here. We don't have those kind of policies. We don't practice any of that type of stuff here. Unfortunately, they have it in their policy up there. And so I am also putting together a meeting. We have a community advisory board for the sheriff's office. If you are 50 more than 50 commissioned deputies or law enforcement officers as a department, you're required by state law to have a community advisory board. And so we meet every quarter. It's not that time to meet. However, I want to put together new, or not a new, but I want to convene that group this week so we can start talking about some of the issues that have been present and start talking about maybe some of the things that, some resolutions and those type of things. We're also meeting with the DA's office. The DA's office has been trying to pull together a meeting with different community leaders because they have to be part of that discussion as well. And so I think we're at a point now, again, where I think some of those discussions can start taking place, meaningful discussions. There's some things that are being talked about that I don't know if we'll ever be able to accommodate. But there is some things that I think that once calmer heads prevail, that we can sit down and have those meaningful conversations and come to a workable agreement on some changes. And so with that, I'll stand for any questions.
Okay. Thank you, Sheriff. Appreciate, I know you were well prepared for last weekend. There was a lot going on Friday night, Saturday night. I happened to be downtown Saturday night and walked over by NASCAR Park, and there was quite a large crowd there. But I'm so glad it was peaceful. And
it was very
really
peaceful.
Yeah,
there was
it
about
was really
300,
good.
350 people there.
Yeah.
No issues whatsoever.
I know, so thank you, and my compliments to your working with the Wichita Police Department and cooperation, and so it's all good. So thank you for that update.
Right.
Any other
Thank you.
questions? Okay.
All right.
Thank you.
Thank you very much.
Tell your officers we appreciate it very much and their professionalism and to keep being a pros. So thank you.
Thank you.
All right. Good morning, Ellen.
Good morning, how are you?
Fine, thank you.
I would like to update you on what the court and the DA are working together on to address the backlog of traffic cases in traffic court. I believe you all have a little diagram that looks like this.
Was that a napkin? Who did?
You know, it's not a napkin. It's a good piece of paper. Pardon me, but we're going to try to follow along with this. So this is the front plaza, what I call the front plaza of the courthouse. And so the parking garage is over here. And so when people come to the courthouse, they normally come up this diagonal sidewalk. But we have a backlog of almost 5,000 traffic cases that, hearings that had to be continued during the shutdown, new cases that were filed during the shutdown, and then cases that just continue to be filed still. So we had to get creative on how we are going to address this large number of people, given the fact that we have restrictions from the Supreme Court of how many people we can have in a courtroom, as well as trying to maintain social distancing. So the DA's office and the court got together and we came up with this plan. We have 5 pop-up tents that we plan to set up in front of the flower beds here, all in a row. And so people, rather than coming up the diagonal sidewalk, if you're here for traffic, you will come down the main sidewalk along Main Street, and we will have court personnel out here triaging the people as they come to hand out masks and then also find out what they are here for. And so tents 1 and 2 will be manned by the court staff, and tents 3, 4, and 5 will be manned by the district attorney staff. So if you are here only to get a continuance for your case, try to set another date, you will go to tent 1 and they will be able to help you outside, get that taken care of, and you can go on your way. If you're here to apply for a court-appointed attorney, you will go to tent 2. Same way, we can do all that outside, get it taken care of, go on your way. If you need to visit with the DA and show proof of a driver's license, or your ticket is for not having your insurance card and you need to be able to prove that, you can do that outside and go on. Number 4, if you need to set a trial, if you want to set a court date, you will go here and visit with the DA. Tent 5 is a catch-all. If you don't think 1 through 4 apply to you and you're here for something else, you'll go to tent 5, where the DA will probably tell you whether you need to go to 1 through 4, but it's possible that you may actually need to go inside. So if you're here to make a payment, you'll go inside and make a payment at the first floor payment station. If you're here with your attorney, you will go inside, and we are having the judge come down to the first floor in the jury room, since we're not having jury trials right now. And the DA will be in there, and the judge will be in there, and you can plead guilty. You can have a hearing if you need to. So the idea is to divert as many people as possible away from having to come into the courthouse and taking care of their needs outside. So this will be Mondays, Tuesdays, and Thursdays, starting this coming Monday, June 15th. And right now we have it set through July 31st. We will see at that point if we need to go that long or if we need to extend it. We're expecting quite a large response, but we will see as it goes along. I'm happy to answer any questions.
Commissioner Cruz?
Thank you. Thank you for this graphic. I wonder if, is Tony or someone going to be helping with communication as far as graphics to help people know where to go? Because I had to tell you, this is kind of confusing, so I hope we're going to do something a little different than this.
The tents have slots in them where we can put signs as to what they are. And like I said, as people come up the sidewalk, court staff will be out there doing what we call triage and helping them know which area to go to.
Okay. It's going to be hot.
Not as hot as last week, hopefully.
Oh, okay. Okay. Well, looks like you guys found hopefully a solution to move people along.
We're having to think outside the box, and this is what we came up with first, so.
Okay.
Okay.
Okay, thank you.
Oh, Commissioner Howell.
Thank you.
Sorry.
Just a thought, are the tents designed to handle inclement weather, high winds, things like that?
No, if we have inclement weather, we're probably just gonna have to shut down for the day. We've worked with David Spears at Public Works, and he's gonna provide sandbags for, them to be stabilized. But if it is a deluge of rain, there's not gonna be a lot we can do, because we will have to move our computer equipment back inside.
Okay, and then the other question is, are you using existing revenues in your budgets already, or is this going to be additional money that's needed to support all this?
Well, the tents were purchased through the CARES funds.
Okay,
And I think we purchased 2 outside access or booster points for the wireless networks out of CARES funds, but everything else is just existing equipment.
okay, all right, thank you very much. Thank you, Chairman.
Okay, Ellen, I don't see any other.
Okay.
Thanks for the update.
Thank you.
Good luck with everything.
Thank you.
Okay, Adrian will start us off on the COVID discussion.
Good morning, Adrian.
Good morning, Commissioners and Board of Health. Adrienne Burns, Sedgwick County Health Director. In Kansas, we have 10,650 cases of COVID-19, and in Sedgwick County, we have 660 cases. We've had a total of 456 people that have recovered and 22 deaths. We provide daily updates on our website, and any resident can be tested for COVID-19. They just need to call 211, whether they are symptomatic or asymptomatic. There is no out-of-pocket cost, and we will get you scheduled for an appointment. On May 26th, Governor Kelly announced that local governments would be able to determine how quickly their communities reopened, and that the Ad Astra plan was to be considered as recommendations or guidelines. On May 27th, the Board of County Commissioners voted not to impose additional limits on the community based on certain conditions or current conditions, and recommendations that Sedgwick County residents and businesses continue to adhere to the phases and guidance in the Ad Astra plan, with a modification that it further defines public gatherings as persons commonly known to one another, and allow gatherings up to 20 individuals rather than 15. Excuse me. Due to increased community activity and the fact that our case counts had not been decreasing and had been increasing, Dr. Minns, our health officer, shared his recommendations on Friday that we stay in phase 2 for 2 incubation periods, or 28 days, which has us extended until July 3rd recommendation. And as we continue to reopen businesses and begin gathering and continuing with peaceful protests, it's important to remember that if you can't distance, have the physical or social distance of 6 feet, to please wear a mask, and always to keep the hands away from the eyes, nose, and mouth. Wash hands as well. So to help monitor COVID-19 and other disease trends in the community, we're setting up, we have the questionnaire and are setting up on the website for businesses to be able to voluntarily report the total number of employees who are sick. We'll be asking businesses to report the number sick each Thursday for comparison purposes. This is totally voluntary. Businesses can report the other days as well. We are going to pilot this week, so we know that it goes well. I had mentioned this in the beginning, but really hadn't followed up on it. So again, the participation is voluntary, and we've done this sort of thing for years, reporting online with our nurses at USD 259 and other schools, where they can go into a website and report school illnesses, and that gives us a feel for what's going on in the community when we know what's going on with the kids. And so all the data will be reported weekly in aggregate form. Nothing will be identifiable from any of the businesses that do participate. And not always a lot of schools participate in the reporting, but the ones that do, we appreciate, and then we provide them data as well for what's going on in their location. So again, businesses that participate will receive a weekly total sick report and COVID-19 update from Sedgwick County, including recovery metrics, potential second wave of infection and COVID-19 vaccination. The form will ask for the name and address of the organization, the name and contact information of the person reporting the data, if there were multiple locations reported, date illnesses were counted, number of employees who were sick, and number of employees who were working. Daily total sick reporting does not include planned vacation leave, jury duty, and other non-sick leave. Again, more information will be coming out about that. We want to pilot that to make sure the form is as easy to follow as we hope that it is. And then in closing, just a reminder about our random sampling that will occur June 18th through 20th. The call center that we will be having contact people is not 211. We're having, there's been a lot of our residents in the community that really want to participate and have been excited about it and have been calling 211 thinking that that's the call center that will be handling those calls, but it's not 211. It is a separate company, and for this you can't volunteer. You can volunteer when the company calls you, if you're one of those 6,000 numbers that gets called for the 1,600 people that we're looking for to test on those days. And that number will be from a county prefix. So we're not giving the entire number because of the concern of the company getting flooded with people really wanting to participate, but it will be from the Sedgwick County 316 and then 660 prefix. So when that begins happening at the latter part of this week, if that 66 number calls, please pick up, and it's totally voluntary whether or not you participate. There'll be no charge whatsoever. And for anyone else that just wants to get tested but is not ill, please call 211 and we will get you set up for an appointment. Be happy to answer any questions.
Okay. Thank you, Adrian. I'm glad. So now you've said it twice, but the citizens, if they want to be tested, they can call 211 and get set up an appointment. And that's not part of the random sampling. In the random sampling, the citizens are not in charge of being on the random sampling list. That's a true random sampling that we've
Yes.
hired out privately to make sure we have a good cross-section under all the data that would verify a valid random sampling for our community. Okay, thank you. That's very helpful. Thanks for the report. Any questions so far? Nope. Okay.
Thank you.
Thank you, Adrian. Thanks for all you do.
Good morning, Commissioners. Tim Kaufman, Deputy County Manager. Give you a brief testing update. Last week, our testing unit saw 339 individuals. Included in that, on Thursday and Friday, we had 47 folks that were asymptomatic. that called in earlier in the week and asked to be scheduled to be tested, and so we got those folks through. And we believe that that process is working. That represents about 37% of the population that we tested on Thursday and Friday, so a little bit more than a third of the folks that we tested on those 2 days since we opened up to asymptomatic testing was for those folks that are asymptomatic. So again, we still want to focus and emphasize that primarily we want to test folks that are symptomatic and make sure that we get them into the right treatment and that sort of thing. But again, close to 40% of the folks that we tested were asymptomatic. So I think that's a good sign, and it indicates that there's a demand out in the community. And as we've seen with folks calling to be participants in the random sample, there is a willingness, and that's really encouraging. As Adrian
Tim,
mentioned.
can I, just for if the public's watching, make sure you define what asymptomatic means.
Asymptomatic is anyone who doesn't have symptoms, and so we've talked for weeks about the different symptoms that folks have. Fever, shortness of breath, chest tightness, all of those different symptoms that could be indicators of COVID-19. We want to have those folks call 211 and get scheduled to get tested. But we're also now ready to test anybody who's not showing any symptoms. So I guess that's the easy way to describe it. Anybody who's not showing any symptoms at all, we still make tests available for them as well. Because as we know with this particular disease, you can have the disease and not have any symptoms, not demonstrate any symptoms. So it's a good reminder to be able to talk about, now we're ready to test anyone in the community. And then, as Adrian mentioned, we've got telephone numbers for 6,000 people in the community. We've turned those numbers over to a call center that is going to be making outbound calls to invite people to participate in that random sample that will happen next week. Those callers will be able to schedule folks. I'll describe the process, and they'll be able to schedule folks. We've got 6,000 numbers. We're going to call until we get 1,600 folks scheduled, because we'd like to have 1,400 samples taken. And we know from the current drive-through testing site that we have, even though we schedule folks, not everybody shows up. So we know that we need to overschedule just a little bit. And we will be sending out postcards. I believe they go out today to let people know that we will be calling them again, to remind them that the call that's coming out is going to come from a 660 prefix number, so that they'll know that it's okay to answer that call and that it's going to be us trying to get them scheduled for that sampling that will happen next week. Be happy to answer any questions.
Okay, that's good. I'm glad. So the 660, the postcard will be an advance notice, 6,000 of them?
Tony's going to show it, yeah.
Okay. That's the postcard that you will be mailed if you're one of the 6,000 citizens, and then you will receive a call from your caller ID will show a 660 number.
Correct. And we're, communications is going to work with a couple of different targeted communications firms in the community, so they'll help get this message out as well in terms of getting it out in Spanish. The call center that we're using has folks that are fluent in English and Spanish, and so they'll be able to manage those calls as well.
Commissioner Howell has a question.
Yeah, thank you, Mr. Chairman. So back to the asymptomatic testing. Have we turned anybody away because we didn't have time to test anybody, or do we test everybody that was desired to be tested?
I believe that we've been able to test everybody that we got a hold of. We do have to call, some of the folks we have to call back, and we may not have called everyone that called us. So the way the process works is someone calls 211, they indicate a desire to be tested. That information goes to our nurse triage line, and then our nurse triage line calls them back to get them scheduled. And there may have been some instances where our nurse triage line had so many calls that they couldn't get in touch with everybody. But I believe that everybody that they've gotten in touch with has been scheduled.
And we're going to continue this and see what happens going forward.
We will. Yeah.
I thank you for the report today on that. I hope to see that same type of report as we go forward the next few weeks, to see what type of interest there is in the community. And then with regard to us calling people for that test, I think that's great. I am concerned if I was to receive that call. I always worry about people trying to do a spam call or take advantage of somebody who's very kindly answering questions or whatever, you know, there's always opportunity for someone to take advantage of somebody else imitating government. So if somebody wants to, they get that call, are they going to be allowed to like call someone back to verify through a number that we would, I'm trying to find, how do we manage that issue if someone was trying to victimize somebody pretending to be Sedgwick County?
You know, I'll have to follow up with the call center, see what their protocol is for that. This is an outbound, it's an outbound call center, and they do calling for all sorts of different organizations for all types of reasons. In this particular instance, we've tried to help the call recipient recognize that it's going to be a county, calling on the county behalf by using that 660 prefix number. But I'll have to follow up with them and see how they're handling
And I think
that particular
clearly,
issue.
I think clearly in this matter, when people receive these calls, there will be no asking of credit card numbers
That's what I was
or
gonna
social
get to
security
next.
numbers or numbers. So if that conversation leads that way, you're not getting a legitimate call.
Or money, I mean, if they ask for any
correct.
type of money.
Yes,
or-
this is
or-
all,
or
there's no cost
personal
to people.
information like a social security number, that would be an
be-
indication that this is not right. So,
Yeah, anybody who calls and asks for your social security number, you're absolutely right. That's a scam call.
all right, thank you, appreciate that.
Thanks. Thank you, Tim. Next up is Mr. Rusty.
Morning, Chairman, Commissioners. Very briefly on Emergency Operations Center and protective equipment. It's my understanding that the state has extended their declared state of disaster emergency into September, which means that as long as they have supplies and as long as we demonstrate that we have exhausted our local resources, that we're still eligible to receive assistance from KDM and by extension from the Department of Homeland Security and FEMA, KDHE, those types of organizations at the state and federal level. Currently, our status with protective equipment is that we are continuing to be able to meet those gap needs for those organizations who need a little bit to get them by for a few more days until they get in shipments or until they have what they need. Interestingly, I'm waiting to see what this week's burn rate and supply on hand reports from all those organizations look like. They will be in by close of business today, so I'll see them around or after 5 o'clock today or first thing in the morning. Kind of the trend that I've noticed is that currently first response agencies, police, fire, and EMS, seem to be pretty well supplied. Our hospitals, who are reporting to us, seem to be pretty well supplied and in pretty good shape. When our overall supply on hand numbers begin to dip down a little bit, it appears to be driven largely by long-term care facilities, certain senior care facilities, and certain nonprofits, some of those types of organizations who are still apparently struggling to get the supplies that they need, or at least what they're reporting to us is based on the amount of daily use and the amount on hand. They don't have everything that they need or as much as they'd like. So that seems to be the trend right now. So like I said, I'm anxious to see what this week's looks like. Last week, the number of reporting agencies declined. That might be in part because the states changed the requirements for us to report to the state. And 2 weeks ago, the state requires now that entities that want assistance through Kansas Department of Emergency Management and by extension the federal government and or the county is required to report not only what their daily burn rate is and what their supply on hand is, but also to report what items they have received within the last week, whether they purchased those, whether those were donations, or whether they received those from the county, the state, or the federal government. So it added a little more data that they have to track in their inventory system, and they have to report out how they're receiving and how much they're receiving. So that might be one reason that it declined, I'm not sure. So again, I'm waiting to see what this week looks like, but things seem to be leveling out a little bit. The supply chain may be stabilizing a little bit. It's not there completely yet, but right now we seem to be doing okay, and I'm anxious to see what the next week or two bring in those burn report and supply on hand so we can adjust accordingly. So that's what I have for today.
Okay, Rusty. Commissioner Dennis?
Thank you. Quick question. I was out at Garden Plain over on Saturday because of the hazardous household waste collection point, and when I was talking to the folks out there at Garden Plain, and I'm sure that other communities have the same exact questions, they need some masks to be able to run their courts and a few other things like that. Can they just get a hold of emergency management and get masks delivered to them, or how do we get masks to the small communities?
So what they'll be required to do is they can reach out to emergency management, and our logistics group and our emergency management employees can provide them with the form that they need to fill out. And then when we receive that form, if they are a qualified governmental entity or certain nonprofits that qualify, then we can look at what they need, what we have on hand, and what we can help them with in that regard. So
Okay.
they need to fill out the form, so we have the documentation and we can qualify
Well,
them.
I guess what I'd like to see is, that was one community that I just happened to be talking to, and we got 20-some communities. Is there any way we can get that information out to the leadership in each of our communities here in Sedgwick County?
Sure, and just to be clear, we've had about 146 entities reporting to us, which includes police departments, volunteer fire departments, and other governmental entities from most of our outlying communities. Colwich and I'm not sure if I've seen Mount Hope on there, Valley Center, Park City, Goddard, Derby. Most of those communities outlying have their first response agencies, and a lot of their senior care and long-term care facilities that they have in those communities have all been reporting and asking for materials through us. So, but we can reach out to either the clerks or city administrators in those communities and make sure that they have the information and know how to reach us to make
Yeah, I
those.
appreciate that.
Sure.
One other question. They've got expenses just like every community does that are COVID related. Do they go straight to the county, or do they go through that outside group that we've got set up to be able to get reimbursed for some of the direct to COVID responses? What's the avenue that they take to get to the funding to reimburse them?
I'll take a stab, and then somebody can correct me. Initially, reporting to FEMA or the federal government for assistance was an online process. Historically, in the past, those communities would report through emergency management, and emergency management would report up the chain. But this time with COVID, there was a online application system set up, and Jessica, working on behalf of finance and the Emergency Operations Center, reached out to all of those communities at least 2 times that I know of, providing them with all the information on how to get online and apply and offered assistance to them. And then she's given us a couple of lists of those communities that have applied. Not all of them have applied online. As far as the CARES Act dollars, I will defer to Lindsay or somebody who's more knowledgeable about how we are going to use any of those dollars to help our other municipalities here in the county.
Anything that does not get taken care of through FEMA or other funding mechanisms, they should fill out the survey that is online today, the needs assessment. And governments come first in the process. So all governments should be, if they're not being taken care of through another funding stream, should be filling out that needs assessment. That's the first step. Then we'll put that into a package form between our staff and Whittle Bryan. We'll put that into a package form so you guys can digest it. And then we begin to set the strategic plan on how we're going to spend that money. So and maybe your other question is, we have an outside group, the 7 members of the advisory meeting, the advisory group. We'll look at all of those outside requests coming into the county to give you advice on whether it fits CARES, fits the strategic plan that you set forward, and whether you should approve the money or not. That's how that process will go through. Did Ed
Okay.
catch you?
I just want to make sure we're communicating well, because if that one community had questions, I'm sure that other communities have questions. Thank you.
If I could add to that, I was on the Steve and Ted show this morning and talked about the NOFO, the Notice of Funding Opportunities. and it's the first link on our website. I went there to look at it in preparation, and it's very explanatory. And at the very bottom, it tells you if you're a government agency, schools, nonprofits. You click on that and you fill it out. And this is that 2-week period from Friday to 2 weeks where they're just gathering information. I wasn't able to, because I'm not a nonprofit, I wasn't able to get past the first steps in there. But any of these entities can get in there and fill this out, and it comes to us, and then they do the strategic plan from there. So there's no checks being written yet.
I think we also, I have a list of every administrator or city manager in the county, and we have put that out to all of them early on. And we'll do that again probably at the end of this week, just to remind them that they have 1 week left. So that communication is constantly flowing.
Right. Commissioner Cruz?
I just called all of my city administrators and mentioned this availability to ensure that they knew what was available. And I would suggest all commissioners doing the same thing to all cities in their districts.
Okay. Very good. Thank you, Rusty.
If there's no other COVID questions, then we'll move on to the discussion.
Okay,
regarding
well,
ICT.
I was going to add the NOFO discussion, but we just covered that, so that's good.
And we'll hit it again tomorrow during the
Right,
meeting
okay.
under the CARES agenda item.
Very good.
Can I just say one
Commissioner
more?
Cruz?
I'm sorry, thank you. I did have a question yesterday. There was a group that wanted to apply for the group. And my suggestion, and I'd like for you to maybe clarify, it's more about individual businesses, nonprofits. So they should be applying for themselves,
Yes.
not an entity applying, because we're going to have to ensure like how they're spending this money. So
Yes.
okay, so don't
Yes.
apply for somebody. Tell that somebody to apply for themselves.
Yes. And you're exactly correct. There's going to be a litany of checks and balances moving forward on this. And so if you're applying for someone else, that's going to be the first problem there, because whoever is applying and whoever receives money is going to have to be accountable and responsible, as are we. So yes. I know United Way, for example, will fill out, and they represent a number of entities, but those entities within that group should also be filling out information, and we'll decipher that. But that'd be the only example I could give where maybe one entity's filling out for others, if you're, like United Way is representing a number of.
And then, just to be clear, this goes back to March 1st.
That's correct.
So
Yes.
expenses that have been incurred since then.
Correct. COVID expenses.
Those can be
Reimbursed.
reimbursed through this form. Okay. Thank you, Chairman.
Okay. All right.
Currently in needs assessment stage. You know, my stuff is in needs assessment today.
Rusty, just point out, in case you didn't hear him, it's a needs assessment. It is not an application.
Right.
Today, we are in needs
Exactly.
assessment. Good point.
Yeah, this is the first step. So does this first step include an estimated dollar amount, or is it just a needs assessment? Because I couldn't get past the application process.
That is a Lindsay question.
Yeah,
And I haven't
okay.
been through the process myself. I think, hold on. I think
But that's
she'll call.
okay. I mean, I think it's. all
Lindsay,
these
are
things-
you on?
Yes, I am.
Can you answer the chairman's question, or did you hear it?
I could not hear it because of the delay, so I'm sorry. Can you repeat it?
Lindsay, on this this initial 2 weeks of needs assessment, when any of these entities, school districts, cities, nonprofits, all the 5 categories, when they get on to fill out the application, I couldn't get past the first part of the application because I didn't have my NAICS number and all that stuff. But do they is there a dollar amount? Do they estimate at this point, or is the dollars in the next steps?
No, we asked them to tell us what exactly types of expenses they have and also how much, because that is what we will use to help you all craft what program areas you want and then determine how many dollars you want dedicated to each of those program areas. So we definitely want people to tell us what they think their costs are and will be so that we can make sure we're taking that into account.
Okay, so is it an estimate, or is this the dollar that they're applying for exactly? Is this the application part?
so we want to know actual dollars they've really spent already, but we also want to know if there's going to be ongoing costs. And so there will be opportunities to provide both of those. And this is not an application. This is just to give us an idea. They will have to submit an application once you all have determined what your strategic plan is, and then we'll let them know what all of the requirements are going to be, because the strings that are attached to us from the federal government is going to pass through to those folks, so they need to understand what their audit requirements are going to be and all of that. So we will definitely have more information and training for those individuals when we get to that point.
Okay, that's very helpful information. Thank you, Lindsay. I don't see any other questions.
Okay.
All right, then we'll shift the discussion into ICT 1, and I think Dr. Gallagher is going to start that off.
Morning, Commissioners. I'm John Gallagher, the Director of VMS. This is the formal information for the briefing that you each received last week on the update for the ICT 1 program. I don't think we're not projecting slides, but I've given you a copy of them as we go through. So as you recall, this is oh, you got it? You're a hero. So as you remember, this is a 3-member team made up of a qualified mental health worker, a law enforcement officer, and a paramedic designed to go out into the field and meet the multidisciplinary needs of this population that had previously gone unmet. This is a partnership between the City of Wichita and Sedgwick County. As the program has refined, we've reached a good balance between the Wichita Fire Department providing our hard equipment, the vehicle, the computers, the radios, maintenance, fuel, all those support costs. The Wichita Police Department providing us a law enforcement officer, ComCare providing the qualified mental health worker, and Sedgwick County EMS providing a paramedic. This, after trying out a couple different things, this seemed to be the most efficient and allowed everybody to be at the table for a true city-county partnership. We did make a couple changes to the program at Learn As We Go. The staffing is now occurring in 2-week blocks. This added some operational efficiencies, but also made for more consistency within the team. Over the first couple days, they would get some of their kinks worked out and become a more efficient team for the remainder of the staffing period. And we also saw a change in peak volume that we speculate might have been due to COVID issues, and quite frankly, the city nightlife not being what it once was. The call volume peaks were happening earlier, so we reacted to that and moved the shifts up a couple hours to make sure that we were available for when the people needed us. Up-to-date information gives us a new disposition group pie graph, and you can see that that large green wedge is our target group, our target disposition, which is treat in place. And of all calls considered, we continue to stay healthily above that 50% mark, which is the team's goal. When we look at comparison to the initial pilot program to the continued program, the overall distributions are fairly similar, but you can see some evidence of the team is starting to sharpen the blade and become slightly more efficient in the target areas, and that treat in place has climbed up to 61% of all visits that involve a patient. And that's exactly what we would want. This demonstrates that they've been able to shave off a few more of those calls that previously had to be transported or would have to be handed off to another agency, and we've gotten those safely into the treat in place disposition group. So we believe that this is evidence that the program is continuing to refine.
Dr. Gallagher, Commissioner Cruz has a question.
Do you mind if I ask questions?
Not at all, ma'am.
So I've seen this before, but I just want to ask, with the treat in place, are you going to discuss, with this program not being active, where would those folks go, and how much money would we be utilizing in other parts, would it be the ER or the jail? Where would, if they weren't treated in place, and they are being treated in place, excuse me for not getting my question succinct, where would they go, and how much money would that be? Is that explained in here? Because I think that that's a really important part of this is understanding if we weren't, if this program wasn't in place, if we're not going to treat them in place, where would they go and how much would that cost us?
Sure. I think I have the spirit of the question.
Sorry about that. I haven't had this full cup of coffee yet.
So you're exactly correct. The whole thing is designed not only to better meet the needs of the person, but also to reduce the cost of the places where we had historically been, in many cases, inappropriately taking them. The biggest example being the emergency departments. There are a lot of these people that was the hammer that we had, and we hit it like a nail. And these people would get taken to the emergency department time after time after time. And to your question about what's the dollar savings, there is some information in the detail packet, which is the back portion of what you have, that speaks to more of the numbers, including some of the hospital savings costs. Now, we have to be transparent on this, that those are predictive modelings. Those are guesses based on how many visits we think have been reduced and what those might have cost. As you know, it's very hard to measure something that didn't happen, but we can speculate based on previous experiences. So the short answer is yes, that information is in there. It's not on the slide. The last thing that I want to point out on the slides is, as you recall, this pilot came to us, the idea of it stemmed from a program happening in Colorado Springs and also in Tulsa. We were able to get our hands on the data from the Colorado Springs model, and we're very pleased to see that their pie graph distribution is nearly identical to what we've had here. So we are encouraged to see that we've been able to leverage the same benefits that other communities have, and it's reassuring to see that the distributions are similar. Makes us feel like we're on track with this. So as I pointed out to Commissioner Cruz, there's some more detailed information in the briefing packet which you received. Since you had your individual briefings, a small bit more information was added, including some information surrounding the cost per team per year, as well as what this program might look like if we staffed it for additional time throughout the week, up to and including 24 hours a day. So before we break for additional questions, I just want to say that this has been a really exciting program, and I think an excellent example of the Commission taking a real tangible action towards addressing the mental health needs of the community, and I appreciate you guys being willing to do that. So, thank you.
Okay, thank you, Doctor. I tell you, I'm glad to see it keeps evolving, hours a day, things like that, and it means that you're adapting to the community in supplying these services. And I know it's got some hard costs involved, hard cost savings that are measurable, but the unmeasurable, you guys treating in place right there, who knows what, lives or additional illnesses or all that impact is not real measurable, but it's there, and that's why we were doing this at the start. So I'm encouraged to continue to support this program in its current state and let it continue to evolve.
So to that point, we do have a little bit of a question. We're not sure what the best way to proceed on this is. To your point, we've received overwhelming support on this, and it's clear that people desire the program to continue. But how it's to be funded is a bit up in the air, and I think we need to defer to the manager and to your expertise on the best way to do that. Currently, the staffing is being done through salary savings of unfilled positions in EMS. Joan is here and can speak to how it's being done in ComCare. But what that has done is created an expense of overtime, because we certainly don't want to be shutting down an ambulance to the city. So what we've done is moved that paramedic off of the ambulance onto the ICT-1 team and then backfilled that seat on the ambulance, which has created an overtime expense, and we're able to bear that within the department right now because of some empty FTEs. We're closing that gap, and eventually we won't have the salary savings to be able to do that, and we'll need a more permanent funding source. But the question as to how and when to do that, we would like to defer to your strategic guidance. We could certainly continue doing so foreseeably throughout the rest of this calendar year. But we would also understand that if the right thing to do is to make this a dedicated FTE so that it is upfront and visible as to what those dollars are being spent on, that makes sense to us too. So a question mark on that one.
Well, can you work with the manager and finance and budget process on your budget request? And I think you can come up with the best case. It seems like it is a dedicated FTE world.
It is. So we discussed that with the budget team, and their very sound advice is that it's not common practice to come forward looking for additional FTEs when you currently have FTE vacancies, which I suppose makes a lot of sense. Right now, as of today, we've got 11 openings in EMS, and if we were to create a new FTE, we would not have an extra person. It would go to 12 vacancies in EMS. But on the flip side of that, we understand from a transparency and a record-keeping standpoint that having an FTE that is specifically labeled to that purpose does make sense. So when we talked with budget about this, their advice was when you fill the FTE, that's when you would ask for the extra one that you need. When this came up in conversation about ICT1 is here and before us and we need to be open about it, then the conversation came back of, well, should this have been a decision package or should this be included in the budget issue? So I don't know if that helps or further confuses the issue.
Chairman, I think the timing of this discussion today was in conjunction with the budget discussions while we have time to consider what the commission's will is for 2021. If the commission's will is to move forward with this program and take it away from a pilot to a permanent status, then I think there's a budget ramification to that, and we should plan accordingly. So the timing of this discussion was to get clarity on just that subject.
And to be clear, from a department standpoint, the easiest thing for us would be to create the FTE now, and we will fill it when the personnel matches that. So, but we defer.
Okay. Well, I think we go forward that way, but because it's in cooperation with across the street with the city, and they've got a dedicated law enforcement, law enforcement, and Tammy's got equipment, and so it's. I would think this is and Jones' group has a say-so, or unless it's cooperative between you and Joan, I don't know. But
Do you want to speak to yours is a little different.
So ours is different in that we have funded the position through our revenue fund. So we've been using revenue that we've gotten for our other service delivery to do that. But with COVID, our revenue cost center is losing significant money every month. So we have, in the last week, moved the position into one of our vacant general fund positions because we can't continue to absorb it in our general fund. But we have not occurred additional overtime or anything like that. We have just taken that position out of our staffing table at crisis.
okay, that's helpful information. Commissioner Howell?
Thank you, Mr. Chairman. So, looking at the data here, do we have I was trying to add this up, but do we have a total number of calls we responded to or attempted to respond to in the first 90-day pilot versus what's happened since December?
I suppose it's represented within the two comparison pie charts. This is an update to date, so the table that you would reference is the one that has all of the individual calls. And that is 362.
That's since
Program
what
to
period
date.
of time is that?
Program to date.
Okay. And do you have a way to break that down into I guess it doesn't matter. So if I understand correctly, you're telling me that WFD has pulled out of this in terms of being a team member? That's not happening now?
No, they provide all of the hard equipment, the vehicle, the computers, the radios, the fuel, the
personnel.
maintenance. Correct, they do not provide personnel. The other three departments do. So it's 4-department partnership, 2 on each side, 2 city and 2 county departments.
Okay. Just a couple of observations. First of all, let me just say up front, I want to be invested in mental health solutions for Sedgwick County. I'm not trying to say this isn't a great idea. but I'm trying to figure out whether this is the best we can do for Sedgwick County. So I have some concerns about how many people are receiving services that, are benefiting from the program and the cost of the program. To me, it's not, we haven't tried anything else yet to find out what else out there might be more effective or efficient. So I'm just trying to figure that out. But based on at least the first couple pages here, the numbers that you gave me on the front end here, correct me if I'm wrong, but I'm calculating out about 0.89 treated in place patients per shift. And a shift, of course, is 30 man hours. So we have 30 man hours, and on average we are, I'm not sure I'm doing this right. I think we have basically 1.63 calls per shift, and of that, 0.89 patients are treated in place, or persons are treated in place and not have any other disposition. That seems a little low, and I may be off, but I'd like to have, I guess, you comment on those numbers, see if that's about right.
Sure, I would be the first one to admit that when expressed as a per patient cost, this program is expensive. I personally think it's worth that cost, but it is definitely higher than it costs to deliver care to a traditional 911 patient.
And again, I'm not saying we shouldn't invest, and I'm all for solving problems the best we possibly can. I'm just wondering if this is the best we can do with that same dollars, and so that's really my question here. And then if I understand, you did make some changes to the program design. You changed the hours a little bit between the first pilot and what we've done since December, I guess. And but is there anything else significantly that's changed in the program that you know of?
You know, we were pretty fortunate. I think our first swing was a pretty good swing, and we only had to make some minor changes. The hours adjustment was one. Also, the staffing model of having them work in blocks, I think, was an improvement. So, and then of course the refining where the resources were coming from, what departments could bring forward what expertise or equipment. So small adjustments like that, but very proud of the original team that put it together because they hit it pretty square on the first one. We didn't have to make a lot of changes.
Thank you for that answer. So I have, I guess, four points I would make. Number one, I don't know if this is the right time to do this. I think we, as you said already, we have other staff needs, and I know that when we talked about possibly not having a 3-person team and using, law enforcement as needed, there was some concern that if you made a phone call that you wouldn't get someone for an hour. Well, if that's true, I'm concerned that they have the need for that person on their own staff, and may not be able to give that person up. In other words, if the paramedics, you said you have a number of openings right now, I am concerned about not filling those positions as a priority, because those have to be considered along with this. They're competing for the same dollars, so to speak. In light of this year, we already know about our budget challenges this year. There's a lot of things we could talk about. Just to make the point that we have financial pressures this year. I'm a little concerned about standing up a new program. Again, it's a little bit pricey for what we're getting, but is this the right time? And then I guess along that lines, I would like to know if we would explore some other models. And it doesn't mean this is not a good model, but my opinion is, while we're trying to figure out what's best for Sedgwick County, we have to explore maybe other ideas as well. So we have, various things we've tried, not just, because this hasn't really changed, in my opinion, significantly from its inception. It's generally about the same framework what we started with, but I would like to know if we would explore maybe different other solutions for mental health in our community that maybe ought to be explored as well. So we can see if that ends up being maybe more efficient or effective as we're considering standing this one up. And then finally, I'm glad that we're down to basically Sedgwick County EMS, WPD, and ComCare as the 3 team members. To me, that is simpler. But along that line, if we're going to hire someone full-time for these positions, a couple of things. I would like to see them basically under the umbrella of Sedgwick County or Wichita. I think Sedgwick County makes more sense for jurisdiction, in my opinion. If someone is receiving services outside the city of Wichita, it seems cleaner to me that they are a Sedgwick County person. And in terms of partnerships and collaboration and consolidation, I don't know, we don't need to make this more complex. The simplest answer is to stand this up under Sedgwick County's umbrella and have a financial partnership to make this work. And so to me, it's cleaner for HR, it's cleaner for a number of reasons. I just think that if it's under, in other words, under a management model, they all report to the same management structure, for example, rather than having it split up. So there's a number of reasons why I think if we're going to stand this team up, it would be simpler and cleaner to do it under Sedgwick County. And if they don't like that, then I move it back under Wichita. But I think either way, our partnership with Wichita should be financial. And so if this is what we're going to do going forward, I think we ought to consider, making this a partnership, but it's financial agreement, and we provide the service countywide. And I think we know from experience already that probably 90+% of this is going to be used inside the city limits of Wichita. So I don't know that they ought to. I don't know they ought to necessarily, oppose the fact that we provide a service that we are helping them with, just like we do with our EMS right now. We provide that countywide, but most of the calls are inside of Wichita. Very similarly to that, we could have this team under our umbrella and provide the services to Wichita. And I think that would be a way to handle the jurisdictional thing. I think if we don't do that, if I'm paying taxes in Wichita and I see these folks going outside of Wichita, it brings up concerns. Or better yet, if you're receiving services outside of Wichita, it also brings up some concerns. So I just think that it's a little bit cleaner having Sedgwick County provide that service because it is a countywide service. But that's enough comments. I would love to see us explore other models, and I'm not so sure this is the right time to start this considering our financial pressures. Thank you.
Sure. No, I can appreciate that. Two things come to mind. The first is a quick correction. It's four partners. The Wichita Fire Department has been an absolutely vital partner in providing those things. And the second is, I agree with you. I think that it is wise for us to look at other things that might work better, might work in addition, or might work in replacement. I don't think that should come at the expense of continuing this program, but I do hope that the manager has put innovation in his orders to us and that you would continue to fund additional things. And frankly, if something someday outperforms ICT-1, I don't see why we wouldn't move to something that had proven itself better. So I agree. I hope we continue to experiment with new programs.
Commissioner Dennis.
Thank you, Mr. Chair. I guess my question is for Joan, if you don't mind. And maybe I just don't understand how the program works in this respect, but if one of the people that we treat, that we go out with ICT-1, if they instead came to ComCare to be treated and they had insurance, would we bill their insurance?
Yes, and we do with ICT-1 as well.
Oh, that was my question.
Uh-huh. Yeah.
Okay.
With
So-
their knowledge, if they're capable of making an informed
So we do
decision.
get some revenue if there's someone that has insurance.
Yeah, it's
Right.
pretty minimal, but there is some.
So all the expense that's in here, do we have any way of showing how much of that we've recovered?
When we did a quick glance, it's hard to extract the data. We have a new electronic health record, and we don't track it the same way, but we estimate about 5,000, 6,000 recovered.
Okay, well, as we were looking through what it costs to operate ICT-1, I was just wondering if there was any revenue that came out of it.
Very little.
That's my only question. Thank you very much.
Okay, thank you, Commissioner. Commissioner Cruz.
Thank you. My first question, I guess, is for both Dr. Gallagher and Joan. What other options are out there that we could explore?
I think right now in the mental health space, and I'm going to quickly defer to Joan on this, but is just ripe for the picking. There are so few things being done right now that we could almost do anything and it would move the needle in the right direction. So I think it is limited only by our own creativity. I don't know if you have specifics that you'd like to see.
No, there's several different models. It could be a smaller team of different disciplines. It could be people that help man phone calls in the 911 office to prevent the need to go out. We're doing it through our mobile crisis unit. It's really kind of just unique to each community, and like Dr. Gallagher says, it's up to us to define what that creativity is for our community.
I guess the reason for my question is we have spent, well, I don't want to say we, but you all have spent a ton of time invested in, first of all, studying the program in a different state, figuring out what would work in our community, and then really making it work and fine-tuning it now that it's already going. So the progress that we've made, in my opinion, starting over from scratch with something else, I believe would be a waste of our time. And this, to me, I have the cost avoidance study pulled up. These numbers are really staggering when you look at treating people in place versus taking them to the ER, treating people in place versus taking them to our jail, and then that creates more issues for, I mean, we just heard Ellen House with our court system talking about how backed up they are with their cases. And so, you know, I feel like this is absolutely the right time. In light of everything that's going on, we have a ton of people calling for defunding the police department. Well, what are things that we could do? And this, to me, is a great way of ways to put the money in pockets of programs that are going to help people in our community, rather than asking our police force, who is already trying to maintain order and enhance public safety, provide service, be a social worker, crisis intervention, substance abuse, homelessness, school discipline, you know, I mean, all these things that we require our police department to do. I mean, how much time do they spend being social workers? And now we have a qualified social worker. So to me, this is absolutely the right time. My last question would be, because I appreciate you getting me these numbers as far as enhancing the program. So I see we kind of have a range of spectrum. The cost for the program currently is $277,000. The cost for a 7-day-a-week coverage, $544,052. That would be 2 teams. And then a 24/7 coverage estimate is $1.2 million, which would be 5 teams. So in light of the circumstance that, you know, we heard last week with an increase in suicides, that I had to excuse myself because those numbers are crazy insane. We also have a lot of other groups that are, you know, veterans. Obviously, they have way more suicides per day around the country. How is all of this just going to increase with the economic slowdown, the pandemic, now all of this social unrest? I mean, to me, this seems like we should invest more in these programs. So I would like to discuss the 7-day-a-week coverage, just starting out small, given light of our financial situation. So can you guys talk to me a little bit about that, and how maybe if we could enhance the system, what would be your recommendation?
I think you're exactly correct. And that's the next step that I think I would recommend, would be moving to a 7-day model. Maybe does someday a program like this run 24/7? Perhaps, but I don't think that's the next responsible step. So first point is, I agree with you. Second would be, I think what we would do first is we would go back to our data and identify what is the best time to put on a second team. It may actually not be 7 days a week. It may be taking that second team and hitting the high volume areas. You don't have to be too creative to think that there may be a period where having 2 teams on simultaneously might meet the need better. So I think we would have to go back to the team and look through the technical answers as to what that was. But that option, the 2-team option, is what I would encourage us to pursue.
Do you have anything to add, Joan?
I don't on that, but I just wanted to comment on your previous statement. I think the biggest thing that allows us to continue to be innovative going forward is the partnerships. I mean, that was the hurdle to overcome. I mean, and we got 4 big units of government working together collaboratively. So I agree. I think you can't jump from a 1 shift to 24/7. We don't have that demonstrated need yet to ask for that.
Well, I appreciate everything that you guys do. I know that you eat, sleep, and breathe this. I think that's why we have, you know, professionals who work within our county to give us the information. I know I am not an expert in this field, and I rely on your expertise to inform me so that I can make good decisions based on the data, based on all of these incredible studies that take me quite a while to read. But I would encourage folks, is there any way that we could put these studies on our website? I mean, this cost avoidance study, I mean, where are all of, I mean, we spend a lot of money for these studies. Can we get them posted for everybody to be able to read this study and also the high utilizer study? I think that would be important for people to understand how we're getting our information, how we're basing, our decisions. So let's get that on there. But I appreciate what you do, and I appreciate you getting me this information. Thank you.
Commissioner O'Donnell.
Thank you, Mr. Chairman. Dr. Gallagher, thank you very much for the presentation today and with meeting with us last week. I am glad to see that a lot of these numbers are in the right direction, that our partners at the hospitals are seeing that reduced emergency room visits, which affects all of our health insurance costs and affects a lot of the state budget problems with Medicaid and other issues. So first off, thank you for that. I see value in expanding it. Obviously, with our budget issues right now, I can't support expanding that to the 7-day model or adding a second shift today with all the other struggles we have. But I definitely think I'd like to stay the course with what we're currently doing. And like Joan, Ms. Tammany mentioned earlier, having all those partnerships and us continuing to look for ways to partner with the city of Wichita is the model we need to be doing, not for just, this part of healthcare, but for many other parts of social services as well. So I just want to commend you, Dr. Gallagher, and your team, including Director Tammany as well, for, in my opinion, a very well done job. And please, once again, thank our friends over at the city, Chief Ramsey and Chief Snow, that have been so heavily involved and so helpful to us. That speaks volumes about what we're doing in the community. Thank you.
Okay. Well, it seems there's good support for, and a lot of appreciation for what you've all done and support for going forward. And I think you should work with the budget department on the FTE world and follow probably their recommendation as to how to do this going forward. So thank you, fellow commissioners, for all your comments. And Joan, thank your staff.
Thank you very much.
Doctor, thank your staff for all they're doing. Keep it up. All right. Thank you.
Commissioners, that's all we had for today. I might ask that Tanya come to the podium for a second to talk about tomorrow's meeting and how we're going to handle public comment and kind of the evolution of what we're moving toward.
Good morning, Chairman and Commissioners. As you're aware, we have been receiving public comments via website through public comments and then communications email. So tomorrow, as you are officially on the bench for the commission meeting, we are allowing limited access for the public to make comments. And by limited, that is via by appointment. And so we have two members of the public that have scheduled an appointment tomorrow to make public comment. And so we will bring them in individually to come in, make their comments at the podium, and then allow them to leave so they won't be in here for the duration of the meeting. And so we will start to do that beginning tomorrow for every Wednesday, beginning tomorrow for the commission meeting. So I think you do public comments at the very beginning of the commission meeting. So again, we'll just have two comments for tomorrow. And then I think as the public becomes aware that they're allowed, to come in for those comments, we'll start getting more scheduled. So that's the process for tomorrow.
Okay. Commissioner Cruz.
Thank you, Chairman. Did you mention how they can, do they send an email, do they call, and what's the deadline for them to
Sure.
get that request in?
Sure. They can call the manager's office, and we put that information out on our agenda. So they can call the manager's office, and I think the deadline is Tuesday at 5 to make that scheduled appointment.
Okay. So you can't just show up Wednesday and be expected to speak?
That's not the process as of date. I think we can look into that if that's something that we want to do going forward.
What if someone wanted to observe but not speak?
I think for observation, we are still doing that via Facebook, YouTube, and KPTS as of right now.
Okay.
Okay,
Then.
thank you.
One final thing, Lindsay, as she often does, has good ideas. And tomorrow during the CARES item, she thinks she can set up in here a walkthrough of the assessment process. So you all can see it, watch it all the way through. We won't get stopped at places like we do when we go, like you did, Chairman. So she'll have a presentation ready for that tomorrow to help you see that
Okay,
through. So
that'll be very helpful. Okay.
that's all I had, sir.
Okay. I don't see any other lights on, so thank you, and thank you, public, for watching this staff meeting this morning, and we will see you all tomorrow. Adjourned.